Hi, I'm Dr. Bob, and I'm a pediatric chiropractor in Charlotte, North Carolina. And right now I'm going to share two highly effective methods for stopping ear infections. Now, I refer to these two tips as highly effective because they always help reduce the number of ear infections. And in fact, 80 to 90% of the time, they actually eliminate the infections altogether. Now, while antibiotics can stop an ear infection that's currently present, an antibiotic does very little in preventing future ear infections. And a lot of times this leads to multiple rounds of antibiotics, ear tubes, chronically sick children, and tired, frustrated parents. So the first step is to cut back or completely eliminate dairy from the diet. And the reason for this is because milk and dairy products cause inflammation of the ears, the sinuses, and the respiratory tract, and this leads to infections. So this means cutting back or eliminating cow's milk, yogurt, cheese. If mom is breastfeeding, she should do the same. She should eliminate dairy from her diet as well. Now, for some parents, this is a difficult task because for many kids, dairy is a staple in their diet and they tend to enjoy it. Now, if this is the case, then at the very least, I would recommend substituting cow's milk with an alternative source, such as using almond milk or cashew milk or goat milk if you can find it. One of the most common questions that I'm asked, though, if you do cut back on dairy is, if I'm cutting back on dairy, am I also not reducing the amount of calcium in my child's diet? And the answer is yes, but there are other forms of calcium that you can try or you can substitute. So green leafy vegetables, spinach and kale, broccoli tend to have more calcium than dairy, and they're easily mixed into a smoothie. So my youngest, would eat yogurt all day long if I let him. We don't let him do that. We give it to him in moderation, but we definitely make sure that he gets smoothies on a weekly basis. And we'll use almond milk, which is also an adequate form of calcium. We'll mix some spinach in, and he gets his calcium for the day. Okay, tip number 2 is to supplement vitamin D and probiotics. So first off, vitamin D is a pretty easy supplement to give your child. You can find it readily available in any health food store. In a drop form is the easiest way to get it. You want to use 400 IUs a day for a child. You basically just put a drop on the tip of their tongue on a daily basis. So it's easy and it's inexpensive and it'll boost your child's immune system. Now the second supplement includes probiotics because probiotics provide the healthy microbiome that is needed to fight off viruses and bacteria. These are the two brands that I recommend to patients in my office, and we have the highest success rate with these two brands. You can normally order these online, or you can find them in a health food store, such as Whole Foods. Now, a lot of parents will tell me that their child gets adequate amounts of probiotics through yogurt. And the problem with yogurt is that a lot of times it doesn't have adequate amounts of probiotics, and it's possible that the dairy in the yogurt actually outweighs the benefits of the probiotics. And so since we're trying to cut back on dairy, I would not use yogurt as a reliable source of probiotics. I would supplement it instead. Okay, and now a bonus tip that I will give is for parents that have either already cut back on dairy or they've been supplementing vitamin D and probiotics and their child still can't get over these ear infections. My third recommendation, my bonus tip, would be to try chiropractic. Now you do want to make sure that you're seeing a chiropractor that readily treats children. In my office, I will say when parents combine spinal alignment, chiropractic care, with probiotics and vitamin D, 90% of children greatly reduce the amount of ear infections that they have. So they might go down to an ear infection like maybe once a year or so, and 80% of them actually eliminate the need for ear tubes. So 80% of the time, if they're scheduled for ear tube surgery or it's recommended that they have ear tubes inserted, they actually, 80% of the time, they don't end up needing the surgery because the ear infections go away and the fluid drains properly. But I just want to show you how this works, though, because when people hear the term pediatric chiropractor, they, a lot of times they'll wince and they'll think, like, is it safe for children to be adjusted by a chiropractor? And the answer is yes, it is safe, but the technique and style is completely different than adjusting adults. when a child's spine has not calcified completely, there's just very little force that's actually required to adjust them. The amount of force that you would use on a child's spine to realign it would be the same as if you took a tomato and you wanted to see if it was ripe. You know, the amount of force that you would put on it, that's about all they need. And the adjustments often resemble a massage more than they do a traditional chiropractic adjustment. But how it actually works is when a child is, say for example, comes into my office and I do an assessment, and the assessment shows that they have a misaligned vertebrae in their spine. It's common for the vertebrae, if it's in the neck area, to put pressure on the eustachian tube or the inner ear and stop it from draining fluid. Now, when the fluid doesn't drain properly, it stays in the inner ear and it creates a great environment for viruses and bacteria to flourish. And so by using this gentle force to realign the vertebrae, we allow the child's inner ear to drain properly. And so this can actually help with both a current ear infection or also prevent future ear infections, because if someone is treating with antibiotics or they're cutting out dairy and they're adding probiotics to their diet, but this misalignment is still keeping the inner ear from draining, that's when you would see reoccurring ear infections, because the problem or the source, the root cause of the problem is still present. All right, now hopefully you've enjoyed this video. If you have any questions or would like to schedule an appointment and have your child evaluated, follow the link or check out our website at www.activelifenc.com.
So here we have a pediatric patient of ours who's been coming in for a few weeks now. What originally brought you and your daughter in here?
So we originally brought her in. She was just a very fussy baby, had a lot of gas, like more than what I would consider to be normal for newborns, and just didn't settle very well. So a lot of people had said, recommending chiropractor, so brought her in, and marketably different, a lot less gas. She seems a lot more relaxed. As you can tell, she's not really fidgeting or anything much right now, and just overall seems to be happier.
That's awesome. Yeah. Awesome.
For more health tips, strategies, and random facts about us, follow us on Facebook, YouTube, and Instagram.